We've been following stories about spine surgery for quite some time now. And today, the introduction of and the funding for more spots for critical spine surgeries and spine care. Two guests join us on 680 CJOB from the Health Sciences Center Foundation. Its president and CEO, Jonathon Lyon. Dr. Ed Buchel is Provincial Surgery Specialty Lead at Shared Health. Thank you both for joining us this afternoon. Appreciate you taking the time to join us.
Great to be with you.
Dr. Buchel, today's announcement centers not just at Health Sciences Center, but in Brandon and Concordia. Can you help us understand the wait for spinal care and how this is going to start to address not just the wait, but the need?
Yeah, well, the wait is pretty simple. There's two big waiting sort of hurdles to get over. One is when you have back pain, spine problems, and your referring physician or alternate or healthcare provider sends you to a spine surgeon, you have to be seen first. So one is our clinic. We have a provincial clinic that's being developed, and then most of the people who actually have back pain, and it can be debilitating, actually don't need surgery. Probably in the range of 20% of people who have back pain need surgery. The next wait then comes for those people. Of the huge number of people waiting to be seen, 20 or 15% of them or even less need surgery, and this is where we're increasing that capacity as well. More rooms to deliver surgical care in, meaning more operating rooms, but on top of that, better equipment. So the surgery you actually get in those operating rooms is more minimally invasive, quicker recoveries, less pain, better outcomes. So clinic time increasing, collaborative care models developed, operating rooms being increased, and better care being delivered in those operating rooms, not just at HSC. At HSC, Concordia, Brandon, Maples.
Dr. Buchel, would there be hundreds waiting for surgery right now, and what could this reduce the time to?
So yes, there are hundreds waiting for surgery right now. There are thousands waiting to be seen right now. Our hope is to pull these down to within targeted wait times within the next few years. That doesn't mean people are going to be waiting years to be seen. It means we're going to be decreasing the wait list time year over year over year. We hope to have a very transparent, robust waitlist system available within short order in our province. It's been our main focus. We should have that available to be able to tell you, the patient, the referring doc, and everyone where they're waiting, how long they'll be waiting for, and that transparency is really a welcome change in our surgical program that we should have up and running very, very shortly.
I want to circle back to that because I think there's some important questions we both have for you on that. But John Lyon, talk about HSC's role in all this and the foundation.
Yeah, this is a great story about collaboration between the provincial government, and we were pleased to be joined by the Health Minister, Uzoma Asegwar, today, where the minister announced the $12 million for augmented support for spine care to get at these wait lists. And this builds upon our foundations, and the province is in partnership with us for Operation Excellence, which, again, the goal is to eliminate wait lists to targeted wait times in short order. So we have, through the generosity of our donors, acquired, in partnership with the provincial government, new less invasive medical equipment that Dr. Buchel was referring to, and we're building out new operating room capacity under our plan. And this is just another augmentation and support to it, a significant one that is going to have tangible benefits to the people of Manitoba so that we can get timely care when we need it, better health outcomes, shorter hospital stays, better patient care. That's what the government of Manitoba, through the ministry and the minister, announced in partnership again with our foundation and Dr. Buchel today. It's a community collaboration, and it's a great thing for the benefit of all Manitobans.
Jonathon, attach the number that this foundation is putting into this, because we know through the foundation that's coming directly from the people of Manitoba.
You know, specific numbers are in the to be determined because we're still in construction. But I will tell you, the community has responded, enormously, have been very supportive of our Operation Excellence. We'll have more updates on that for another day. We've raised, frankly, tens of millions of dollars, and we have money to support the plans today, and we're continuing to raise funds to support the plans needed tomorrow, so that again we can all get to the point where we do not have surgical wait times, or at least surgical wait times that fall within targeted wait times as they're measured. That's the goal, and working collaboratively with the government, with the healthcare leadership, and the generosity of our donors, we're going to accomplish that unquestionably.
Dr. Ed Buchel, what is the targeted wait times to be seen and for surgery, and what are they now?
Well, they depend on what surgery you're waiting for, and then a prioritized list. So everybody with a specific type of cancer or problem that needs surgery will be prioritized. Most have a 1 through 4 prioritization list, 1 being, you need this. These are elective scheduled cases, first of all. It's not our emergency cases that come up and they go within seconds. These are the ones that are scheduled, and they're prioritized within a few days to maybe 1 or 2 weeks, 1 or 2 weeks to 1 month, and then 1 month to a couple, and then maybe a few more depending on the prioritization. So it's very difficult to say what are the wait lists for any specific person right now, but that is the plan of our new surgical waitlist information management system. This is something that is fundamentally changing to our province.
You've been working on this for quite some time, Dr. Buchel.
It's called SWIMS, I remember.
Yeah, it's very core. You can't run a business unless you know what the demand is on your business. I can't schedule people if I don't know what the resources are that I have. Transparency is very, very important. The government believes that this data-informed decision-making is fundamental in our healthcare system, especially surgery. We're very expensive, and we have wait lists that are unacceptable. We are going to make them transparent.
So how does this technology help solve the problem?
Tells me who's waiting, where they're waiting, what they're waiting for, when, meaning how long they're waiting, and then why, which is what are the resources that are impacting their care. And we did that for spine, and that's how we got to this. We figured out the why. We figured out how many, who, what, where, when, why. Our data has said we needed clinics, we needed ORs, but I didn't just need ORs at Concordia. I didn't just need ORs at HSC. I needed ORs with the equipment at HSC and Concordia. That then allowed us to develop a system that we can recruit and retain the best. 3 new spine surgeons in the last 10 months.
Wow.
And so now we have a provincial program now.
And so I would think that the work that Jonathon and his foundation is doing is key on that piece. To get 3 surgeons to come here and sign on the dotted line probably speaks to new ORs and new equipment.
It is absolutely. This is absolutely how the foundation makes massive gains, more than just the buying of the equipment, but it's fully embedded in the development of these provincial programs now. Our foundation at HSC doesn't just buy a new piece of equipment. It buys a targeted piece of equipment. It builds operating rooms. It develops clinics that are changing to the way we deliver care. Those things together allow us to recruit and retain the best and train the best. Training our kids to stay in our province to care for us. Training, recruitment, retention is built on a foundation of excellence. That's what the foundation stands for. That's what we're building in a provincial program.
Well, today, spine surgeries, we look more towards more in the future. Thanks and congratulations to you both.
Thank you.
Thank you.
Dr. Ed Buchel, Provincial Surgery Specialty Lead at Shared Health. Jonathon Lyon, President and CEO of the Health Sciences Centre Foundation, joining us live to 447.